the 1960s, childhood cancer survival rates have risen from 28% to almost 80% today. Because the number of survivors is growing, doctors are now able to learn more about the long-term physical and psychological effects of both treatment of the cancer and the childhood disease itself. Dr. Tom Linden reports.
Like most other kids her age, 9-year-old Shima Regimond is full of life. But unlike many children, Shima visits UNC Hospital's Lineberger Comprehensive Cancer Center every month for follow-up care for the cancer doctors diagnosed 2 years ago.
When I went to the pediatricians, he felt my stomach to see if I was okay, but that second his face turned red, and that second I knew that there was something wrong. We all did.
Later, her doctor diagnosed acute lymphoblastic leukemia. That led to months of chemotherapy.
You know, she would get sick, and she lost all her hair. That was another really sad part, because some days, you know, she'd be sitting there, all of a sudden, you know, a whole bunch of hair would fall off, and it was just knowing that what she was going through, I mean, that was harder. I mean, I could accept her with no hair, but I know it was hard for her, and going to school.
Shima losing her hair was one of many potential side effects of her chemotherapy. Her doctor, UNC pediatric cancer specialist Stuart Gold, explains.
And chemotherapy affects the normal cells of the body as well as the abnormal cells or the cancer cells of the body. The side effects will vary dependent, again, on the type of chemotherapy. Probably the easiest way to think about it is the chemotherapy can potentially affect any organ in the body. It could affect the heart, the kidneys, the lungs, the liver, growth and development, the brain. Ooh, that one has spiders. Oh, cool.
In children, these treatments carry different risks than in adults simply because children are still maturing. Children also live longer with cancer than adult patients, and so children face a greater risk of cancer recurring. They also risk damage to their growth, development, and learning. Dr. Philip Rosoff is the director of the long-term follow-up clinic for childhood cancer patients at Duke University Medical Center. The center follows pediatric patients after treatment to learn what happens to them as they grow up.
Treatments, when used on children that are growing and developing, can have profound effects on growth and development, on hormonal function, particularly things like fertility, ability to grow tall, to go into puberty, etc., that can stay with a person lifelong.
When Kathy Kernodle was 13 years old, doctors diagnosed a rare type of muscle cancer. To stop the cancer, the 13-year-old got radiation therapy and chemotherapy that lasted until she was 15. But 7 years after her initial diagnosis...
It's right after I was married. We moved back to North Carolina. We had been living in Texas. We moved back to North Carolina. I had a new health care provider, and they kept saying, we want to get a baseline chest x-ray because you've had a history of cancer. And on that x-ray, it showed a tumor in my right lung. And that was right in 1985, around the time of my first anniversary.
The cancer had recurred. Kathy says the memories of her childhood treatment were so unpleasant that she initially refused chemotherapy. Instead, doctors removed her right lung. 1 year later, she had a second recurrence. This time, she accepted both radiation and chemotherapy, but at a cost.
The long-term effects with one lung, and I've had radiation to my heart, I get tired very easily. And as such, over the years, I've discovered that working about 32 hours a week is all I can work.
Cancer doesn't come back in every child who's treated, but even in the best possible outcomes, like Lori Durham, for example, childhood cancer leaves its scars.
Lori was 10 years old when Duke doctors discovered she had Hodgkin's lymphoma. Her mother, Linda Macia, explains.
It was like a nightmare. You just never think that your child is ever going to have a terrible disease like that.
Despite the frightening diagnosis, Lori hasn't had a recurrence of her cancer since her initial treatment.
I mean, I think about it a lot, but
Now I just look back and I think how lucky I am to be alive and to have my kids and my family. I went through a lot. It was just, you know, rough. I can't imagine if it were to happen to my kids. Well, I think having gone through everything that she's gone through, I think Lori has a much bigger and better appreciation for life itself. I think she understands and has always understood that she's very lucky to be alive and that she was very lucky to have had the children.
Rose, please call 222.
For Shima Regimon, the future is uncertain. But like Lori Durham and Kathy Kernodle, Shima is optimistic.
You just have to be positive, because if you're negative, nothing will happen. If you have to sit in your room and cry for 6 hours, that's not going to work. It'll only make it worse. So you have to be positive.
For all childhood cancer survivors, it's important to receive follow-up care. Doctors hope that by having patients visit them regularly into adulthood, the doctors will then be able to learn more about the long-term effects of having and being treated for childhood cancer.